Hey everyone, it's Connor here from Durham Hearing Specialists. I hope you're doing well, and welcome back to another very interesting video. This is quite an unusual one. I don't think I've ever shown this before on the channel. Certainly I haven't seen any other videos looking at this. What you're going to see in this video is something, well, two things. First of all, as you can see, there's a foreign body in the ear. It's actually a hearing aid. This is a Phonak lyric hearing aid which has gotten horrendously wet, and it's basically welded itself to the ear canal walls, and the ear canal is also a little swollen, so it's very, very, very difficult to get out without causing damage, without hurting the patient. So that's the first thing. The second thing is you're going to see non-infective otitis externa. So what is that? Well, oto is ear and itis is inflammation, so meaning redness, heat, pain, swelling, dysfunction. So otitis is infection of the ear, and externa just means external ear, so ear canal. So normally when we think about an ear infection, otitis externa, we think about bacteria, we think about fungus, we think about the same thing that you would think of if you say you got a cut on your hand and that cut became infected, right? So bacteria probably has invaded the skin, invaded the body, and the body's response to that is to dilate the blood vessels, get fluid into that area, increasing migration of white blood cells into the area, and so on. So it's infected. However, you can get inflammation of the body when there's no pathogen, and that's what we're going to see here. Now, it's not the same as a scratch or trauma per se. This is a very weird example of that, because basically what's happened is the ear has gotten really wet. Now, when you put in a hearing aid like this, which is not common, these hearing aids are not common, it's quite a sort of niche specialist thing, but you use a microscope and you sort of measure the ear canal and size it such that you can get this hearing aid in about 4 millimeters from the eardrum, and then you leave it there. The patient leaves it there for, say, 2.5, 3 months at a time, and they eat with it, sleep with it, shower with it, and so on. So it's sort of like a semi-permanent device. And it can withstand moisture. It's meant, it's built to last. It's meant to withstand quite a bit of moisture. But at a certain point, it can take no more. And these yellow seals, there are actually two in there. And really all you can see is the first yellow seal, but there is another one behind that. What they're designed to do, this is polyurethane, and it's actually hydrophilic, which means that these seals like water. And the seals, or flanges, whatever you want to call them, they're not just there to help the lyrics stay in place. They're actually supposed to wick moisture away from that little cavity that you create. So if you put the hearing aid about 4 millimeters from the eardrum, then there's a little space, isn't there, between the eardrum and the lyrics. So and that can get humid. Moisture can build up there inside the ear. So the seals are meant to draw moisture away and out of the ear, the hydrophilic. But when this lyric got wet, the patient did the worst thing that he could have done. He went into a steam room for ages and ages and ages. So of course, these yellow seals became absolutely saturated, and when they become saturated, they stick. As I said, they weld themselves to the ear canal wall, but also they lose that ability to wick moisture away from the eardrum. And what you get is this very weird, unusual looking case where the ear is just so wet and damp and soggy that it looks horrendously infected, but actually it's not. So these are special crocodile forceps specifically for this job. The reason, in case you're wondering at this point, you may think, well, God, there's a lot of faffing around here, with a hook and forceps and so on and so forth. It's basically, back in the early days when I first started doing these, I'll never forget, I pulled on the blue strings. So the patient needed, the lyric had failed because it had gotten wet. So I thought, you know what, sod it, I'll pull on the blue strings and just yank it out. Wrong thing to do, because this is very, very different to removing wax or plugs of dead skin. It's a very, very different skill set, because if you yank it out, you will cause horrendous pain, but also you will cause damage. So when you're removing a wet lyric like this, there's often a very, very fine balance between getting it out, but also getting it out in the sense that it's not going to hurt, and getting it out such that you minimize the damage, you minimize the trauma to the ear canal. And really, I mean, the worst that will happen is that you have hematoma. So you have bleeding underneath the skin, but you have really big hematomas. That you can get hematomas on the eardrum, or hematomas of the ear canal, which are so big that, which is a blood blister. So you have a blood blister which is so big it, it obscures the ear canal. So here now we just have enough purchase on this lyric. I've skimmed around it enough times with this metal hook to loosen the seals. And if you're wondering why it was so kind of liquidy and oily, I did apply olive oil just because I was struggling so much. I don't know if that helped, but it's in the medical guidance from Phonak. You can apply a lubricant, so not entirely sure if it helped or not, but there we go. And there we have it. So here's the ear canal. I'm going to pause it here. So you can see, had you not seen the lyric come out and seen the amount of trouble we had, you would look in that ear and you think that is really infected. You would assume that either the white stuff is pus, or it's some kind of candida overgrowth, like a yeast infection. There's also, redness and, a little bit of bruising there. But what the white stuff is basically lots of soggy, dead skin filling the ear canal. And this ear canal will develop a large hematoma. I reviewed the patient a couple of days later, and there was a big old blood blister in there. So, and that's just a consequence of really just trying to get the lyric out. Remember, it's stuck in there and it needs to come out. So in terms of symptoms, it looks much worse than it is. So as soon as the lyric was removed, patient was fine, no pain, no discomfort. Hearing had returned to what it was before I fitted the lyric. So the only kind of discomfort for the patient is really when you're going through the process of trying to get it out, which is tricky, very, very tricky. And again, with this type of case, it pays to not be heavy-handed. You can't be heavy-handed, because then if you yank it, then you're in a world of trouble, because then it's still stuck in there, but the patient is then very distrustful of you, and they can kind of flinch and kind of, when you're trying to get it out, they're kind of moving away from you, which is incredibly difficult and frustrating. And it's even more difficult to get out, because when you yank it, you will have caused possibly some bleeding or hematoma, and then the ear canal is even more sensitive, and the lyric is lodged in a very damaged, painful ear canal, and then you have to extract it. Quite interesting after you've removed a wet lyric, and it looks almost the perfect imitation of infection, but of course it's not. It's non-infective Otitis externa. So there we go. I hope you found that video interesting. If you have any questions, leave them down in the comment section below, and I will try my very best to get back to you. And of course, I will see you guys on the next video.